talk to me a little bit about the Destiny-Breast04, like the setting of trastuzumab deruxtecan, what did the study contain, and a little bit about the results.
So yeah, as you mentioned, T-DXd after DB03 and after also DB01 in the beginning was an amazing drug for a small subset of patients with breast cancer, those with HER2 positive disease. We are talking of 15% of the patients, but in truth, the number is even lowering now because we are curing them early. We got so many good drugs that we see less and less recurrence in HER2 positive metastatic breast cancer. So we have something around 10 to 15% of the patients. So the idea was like, can the benefit of this drug, this very potent drug, be observed even beyond the canonical boundaries of HER2 positivity? Not 15%, but 50%, half of all the patients. And this is basically what Destiny-Breast04 looked for. So it basically came from a small cohort of basically 40 patients in a phase 1 trial where T-DXd had almost 40% response rate in this HER2-low population. And nobody knew what HER2-low was because we never talked of HER2-low. We always had HER2 positive and HER2 negative.
Yes.
But now suddenly, this low expression of HER2, immunohistochemistry 1+ or 2+ non-amplified, seemed to be actionable in a phase 1 trial.
Yes.
But we needed a phase 3 trial.
Yes.
And the phase 3 trial was Destiny-Breast04, taking patients with mostly hormone receptor positive HER2-low metastatic breast cancer, and also a few patients with triple negative HER2-low that had been previously treated with endocrine treatment, most of them also with CDK4/6 inhibitors, and with 1 to 2 lines of chemotherapy, a median of 1 line of chemotherapy, comparing in this second-line chemotherapy setting T-DXd versus physician choice of chemotherapy. Yes. And the choice of chemo was all agents we give every day, eribulin, capecitabine, vinorelbine, taxanes. And basically what was observed is that T-DXd doubled progression-free survival. Progression-free survival was about 5 months with chemo, 10 months with T-DXd.
Impressive.
Approaching 1 year, you can see the curves both for PFS and overall survival diverging very early.
Yep.
And one impressive thing of ADCs seen with T-DXd and others is that the delta in overall survival was even more larger than the PFS one. There was a 5-month delta in PFS and a 6 months delta, more than 6 months delta in overall survival, statistically improved, showing that probably if you kill the aggressive clones early, maybe you get a sustained overall survival benefit. That is something we don't get with every drug.